It's 1:04, November 20th. Can we, Claudia, could we have a roll call, please?
Yes. Member Barrage? Member Bradley?
Here.
Member Purse?
Here.
Member McFerry? Member Anto?
Here.
Member Altman?
Here.
Dr. Miller?
Here.
Member Avian?
Here?
Member Wilford?
Here.
Thank you. And welcome to our new member, Mariana Wolford.
Thank you.
Thank you. Glad you're here.
It's impressive that you've been to many of our meetings and you still want to sit on the committee.
That's the reason I did. It was the one thing
Good
when
for
I
you.
left the county that I was sad that I wasn't going to be part of.
Good for you.
Well, it was
Thank
at
you.
the top of the list.
Thank you
so
very much.
I'm excited
Yeah,
to
wonderful.
discuss this.
So this is the time for members of the public. They're welcome to address the committee on items not listed on the agenda, but within the jurisdiction of the committee. The committee is prohibited by law from taking action on matters not on the agenda, but may ask questions to clarify the speaker's comment. The committee limits testimonies on matters not on the agenda to 3 minutes per person and not more than 10 minutes for a particular subject at the direction of the chair. There's a link to that you can write your topic to, Measure B at mendocinocounty.gov. So all meetings are recorded. Once your item is announced, please state your first and name. Are there any people from the public waiting to speak? Okay. Moving on to item 3, committee matters. Is there any comment on the minutes from the August 28th regular meeting?
I'll make a motion to approve the minutes as submitted.
I'll second.
All right. May we have a roll call?
Member Wilford? There. Do you approve the minutes?
Do you have a change to the minutes?
Oh, I do, yes, I'm sorry. I'm sorry, I didn't realize that
Wait, were you at the last meeting?
I was at the last
Okay.
meeting. I was there for the county actually, and I do
Yep.
have a change because I remember the report out, and I can verify that with Andy. On the fiscal report, she didn't say that there was, her reports were inaccurate. She said that the revenue came in over budget by 26%. So it wasn't that the reports that were in front of us that were not inaccurate, it was that the revenue came in over budget.
Then I'll change my motion to
Yeah.
approve the minutes as corrected.
And I accept that as a second.
Okay. So can we do the roll call again,
Yes.
please?
Okay.
Member Purse?
Yes.
Member Bradley?
Yes.
Member Altman?
Yes.
Member Anto?
Approve.
Dr. Miller?
Yes.
Member Evian?
Yes.
And Member Wilford?
Yes.
All right. So the minutes are approved unanimously. Item 3B, Mendocino College discussion regarding psychiatric technician certifications. And we have someone to speak to that?
Yeah.
Yeah, sure.
Great.
And I have a PowerPoint also. I don't know how we want to work that guy. So as we're getting that fixed, so I'll just introduce myself. I'm Tim Karras, and I'm the superintendent and president of Mendocino College. I've been at the college now since July of 2020, so however long that has been, that's how long I've been here, about 4, coming up 5 years now. Before joining here as superintendent president, I was president at the College of Alameda, which is next door to Oakland. So I was there for several years. So thank you for inviting me over to give a little presentation today and a discussion. Oh, great. That's so great. Should I just tell you then when to move to the next slides? Okay, you can move to the next slide. That'd be great. If you don't know who we are or where we are, the college, we have the privilege of serving 2 counties. We serve most of Mendocino and Lake counties. There's little bits of both counties or parts of both counties that we don't serve. They're in different school districts. We were formed in 1973, just a little over 50 years ago. We have 7 elected trustees in our area. We have about 3,000 full-time equivalent students in our college. That puts us in the state 103 out of 116. So we are one of the smaller districts in our state of California, one of the smaller colleges in the state of California. And our tuition, of course, we're the wisest place to choose to send a student or a person to go full-time because we're about $1,200, and if you go to a UC, you're going to pay a little bit more than that. So you can just go past that slide. So that's who we are, and that's who I have the privilege to do. So what I'm going to do a little bit is give some, I'll try to go quickly because I'm not sure how much time you want to have for a discussion. How we're organized, especially for our workforce and career pathways, is we kind of are part of a region in our state, of course. Our region that we're fortunate to be in part of is called the Far North. So it's basically Mendocino County up to the Oregon border and then over to the Nevada border. So that's our region. There's about 9 colleges, only 9 in our region out of 116. So our region is not a heavily populated region, so we don't have as many colleges. So we get regional data for workforce. And one area we do get it is, of course, in healthcare and other segments. And just what I have up here is from a recent segment of our industry where we're looking for growth in our areas. And you can see human development is one of the areas that's going to have a big level of growth. And of course, healthcare is the second biggest. So in our region, as we I think all know and experience, those are 2 growing areas, healthcare and human development, which is a lot of mental health and behavioral services, and human services fall in that bucket. There's other areas that aren't growing quite as fast, but that's okay.
Where's healthcare?
Healthcare is, let me be a pointer. Healthcare is this one. So healthcare in our region, so that's our whole region, in the next, well, over these 5 years, we're getting past it, was going to grow about 1,800 people. And education and human development, they were looking to grow at 5,000. So that is like, in our region, that's the biggest area of growth. So when we're looking at programs to our state, we have to tie it back, of course, to where growth is. They don't want us to build programs out that don't have any regional growth. We won't pay for that. And so that's our region. So our region is very strong in those areas, which is great. You can move us along. That'll be fine. This is also just recently put out from our region. It's about just healthcare in particular, about the need in our region again. We focus on middle skill jobs and occupations in my segment. Those are the living wage jobs because we don't do bachelor's or above. We do 2 years and below. And you can see the growth in our area. Again, huge growth in, well, the biggest growth area, of course, is nursing. We all know about nursing in our areas. The second biggest, actually after that, is LVN, which is licensed vocational nursing. And you can see percentage-wise over here, all areas of healthcare in our region, again, are growing pretty good. 8% nursing, medical assisting, 4% projected, social and human services, 8%, LVN, 5%. The only one that's actually, I don't know why it's a decline, because I always need to go to the dentist, it feels like, but dental assistance is actually going down in our region for some reason, but that's regional. Even though I'm always at the dentist needing help. So I think we need more dental assistants. So our region, of course, healthcare is a need for us to build out. You can move it along. Cool. And so going to PsyTech first, and a little bit of story about PsyTech and other programs that we have at the college to help address kind of behavioral and mental health, because it's kind of a bigger picture than just one program. The need to run any facility is just not one position. It's our county needs lots of positions and lots of areas of human services. Is in our state of California, so we have 4 million people in our state of California. There are 16 PsyTech programs in our state currently, so there's not very many in our state, and there's historical reasons pretty much for that in our state, how PsyTech has come out statewide. It's traditionally been in areas that have been close to a state hospital or a prison, because, well, for workforce, those are kind of volume, fortunately, places that might need these positions, so they tend to be co-located near those. So we have 14 in our state currently. Redwoods, they're not on there yet. They might be getting one because of their district includes Pelican Bay, and they've been working with Pelican Bay recently to start probably a program tied to Pelican Bay up in Crescent City. And then in the green, this is something I got through actually first from one of our trustees, Trustee O'Neill, who works in the counseling and behavioral health area, and some of our behavioral health practitioners, is regulations for most psych areas. The regulations allow either for the person to have a psych tech certification or an LVN certification. It can be either for the job. So it's not necessarily requiring a psych tech to work on the premises. It can be an LVN. And so that's why, if you go to your next slide, you look at LVNs in our state for community colleges. There's a lot more LVN programs. Right now there's 35 in California community colleges. This doesn't include adult schools. So in our two counties right now, both in Mendocino and Lake counties, LVNs are part of the adult school pathway. So people can go to our adult school right now through Ukiah Unified and get an LVN certification. Many times LVNs have a greater pathway in careers than something like a psych tech does. LVNs have a breadth of places they can apply to and get jobs, and then go usually into RNs, where psych tech tends to be a little bit more, you kind of go there and you're kind of just placed there, and you don't have a much degree progression or career progression. So that's why there's many more LVNs out there, and the need overall for LVNs outgrows, outside of nursing, that's the only one that's higher than LVNs in our state, is a lot of demand for LVNs. So go on. Sorry for all the state. I'm sorry, sometimes I give way too much data, and these reports I can also give to you too. This is also from our state. This is from Cal Poly Humboldt. Just in June, they did a report about the North Coast, particularly about, and that includes us, again on healthcare and the need. And this one does have psych techs on there. In our region, they are looking, we do need more psych techs in our region, over a 6-year period, about 100 more in our entire region, psych techs, 133. Other areas have high numbers too, of course, community health workers. Everything in this field basically has growth. You can name it a job in health and human services, and there's demand for it. And so this is a really great report about our, this is just the North Coast, so it's not inland. Can you move on? That'd be great. So, workforce, and I think you call it a PUF. I'm trying to get the acronyms right. Ooh, I did it right. So this is the regulations for a PUF. Of course, you probably all know this better than I do. And what I did highlight right now in yellow is the person on site. There's a choice for that employee who is employed. It can either be an RN, which would be the hardest, they'd be the most expensive to have, of course. It could be an LVN or a psych tech. So we have, for a employment avenue, they can have any of those 3 certifications for that job, which is great, because in our community right now, we have 2 of those 3 already present. We have LVN and we have RN already here. So when the PUF opens, because I know I drive past the place all the time on my way to the gym, there is a workforce pathway so when you have a job opening, there will be people qualified in our region to take those jobs. They might not have a psych tech certification at this moment in time, but they'll have one of the other certifications that's required to actually work in the facility. So as an employer, there's still going to be pathways to have someone employed in those jobs. So that's good news, and that I got through through my trustee. He was at a statewide conference on behavioral health, and he's like, "Oh, Tim, do you know that?" And I said, "Well, no, I don't work in that zone." So that was a really nice find for us here, I think. So you can go on. All right, and then just overall for the workforce pipeline for, I think, all the behavioral health facilities that you might oversee, you've done a lot of good work in giving grants out to facilities to help folks in our community. I think you have a lot of jobs that you're going to need in the PUF and other facilities in our county, and I just tried to go through the ones that I thought don't need a bachelor's degree. So if you say, "Tim, you're wrong, some of these need a bachelor's degree," I'm sorry. These ones I thought you might employ that didn't need a bachelor's degree, like caseworkers, mental health, social workers, psych techs, LVNs, registered nurses, community health workers. All these we sort of already have, not for the psych tech, but for many we already have pathways at the college. Sometimes I think people just don't know the pathways exist many times that we already have. Sometimes some of these programs actually struggle for people, even though we have plenty of employment for people. So it's an odd paradigm. Sometimes us getting our voice out a little bit better about what we do offer. So on the right-hand side are all the programs we currently have in certificates and associate's degrees. that are within sort of the human services, behavioral health, mental health world, I would think, that have students in them that we can certainly try to employ locally. And I've also included the adult school. So for instance, the last two on that list, medical assistant and, oh God, phlebotomy, are both through our adult school. We don't have those at the college, but those are our adult school programs that are having graduates right now.
Can I ask you a question?
Oh, sure, please.
So for a site technician,
Yeah.
If someone completed one of those courses or
Mhm.
programs on the right side,
Yeah.
would completing one of them make that person qualified to be a psych?
No, it would not.
It wouldn't,
It would
which is
not.
why you're here.
Yeah, I'm trying to give a bigger
Yeah,
picture,
okay.
especially.
Just wanted to-
Yeah, so yeah, none of those on the
Right.
right-hand side would give you a psych tech certificate. That's a
Right.
own separate program,
Yeah,
which we currently don't have.
right.
And so I just wanted to say we do have other programs that could probably help fill many of the needs that we're building out. So you go ahead, one more. I only have one or two more slides. And so we have a couple of statuses for psych tech in particular. We did mostly in discussion with Napa Valley, because that is our closest program in the state of those 14. Napa Valley has one because they have a state hospital. And so we've been in part discussions with Napa to do a more regional thing for psych techs, because one thing with psych tech, it's not going to have a huge amount of graduates every year over year. It might ebb and flow a little bit, so doing a regional might be better. We've had some success with Siskiyous, College of Siskiyous, way up north in Weed, for paramedics. Many people might have known many years ago we locally discontinued our paramedics program because the continued pipeline was too erratic. But we've partnered with Siskiyous, and now we have paramedics being taught here in Ukiah with the partnership through Siskiyous. So we're hoping maybe to be able to leverage something with Napa, because they have a program that's already accredited.
To have the education here in Mendocino.
Or in partnership.
Okay.
Napa's not too far. They might
Right.
have to do some level at Napa and some part here.
Okay.
But there's no agreement yet with Napa, but we've been having for the last year or so conversations with them. And so we think that could be a possible future way to have a need for having some psych techs here. And then for LVN, I just want to throw it out here because that would be the other position that you could hire for those positions right now that we currently have. Right now, going through the pipeline just was very recent. We had an agreement with the adult schools and with Ukiah Unified. The LVN program is going to move from the adult school to the college. It'll take about 2 years for that to transfer over. And the main reason for doing that, one of the reasons is it lowers the cost for students. As folks know, if you're an adult school student, it's a fee-based program. So it costs a couple $1,000s to go through a fee-based program, whereas if we have it on our side, you pay enrollment fees and you can qualify for things like financial aid. And so students will be able to take the program for a much reduced cost. The program will still be housed at the current facility over at the adult school for now, but it'll just transfer over to us for the management of the program. And so that will be great because we can probably scale up. And for positions coming up right now in the facility, in the PUF, hopefully folks from that program could take those jobs and stay local. And one more slide, I think. That's it. And I can. And this is just a case study for nursing. It's been everyone talks to me usually about nursing in our district. And wanting more nurses, which would be great. And nursing, and this is just one I can do for an example for everything we have pretty much in allied health. PTA, physical therapy assistant is another example, or even the LVN program, is all those programs in the all of our allied health areas, of course, labor market, so everything in allied health has labor market pretty much data, which is great. They've all had significant outside fiscal support, so none of those programs current programs for nursing or for PTA are solely on district dollars. Our general funds don't cover those full programs. We have outside funding in both those programs to make them viable on an ongoing basis. So for any startup probably in allied health, we would need outside grants or whatnot to do it. Even LVN right now, this is transitioning over from the adult school to us. The way it's happening is through outside money, not our general fund. Our general fund won't be supporting that program for a number of years most likely. And then of course, for nursing, clinical rotations. Clinical is in all healthcare is generally the pinch point, or one of the pinch points, because our healthcare providers, we can tap them out pretty quickly. They're all very great in working with us, but there's only so many beds, so many slots, so many people in our communities. And so hopefully with Psych Tech 2, to get it on our side, moving like away from like Napa or our partner, it probably would, for us, we would need outside investment, either from the healthcare providers themselves or grants from the state and other agencies to help push it through, because those programs usually need outside help for us to balance the books. So that was very quick, throwing a lot at you. I'm happy to answer questions about anything we have in human services, as best I can, mental health, allied health, anything you want.
So the Psych Tech program, how
Yeah.
long is that?
That is usually, for certification, it's usually 2 years. It could be a year or two.
And so when you did your PowerPoint slide of how many you believe is going to be necessary or needed for the next whatever years,
Yeah.
are those just coming from interviewing people like Dr. Miller and so forth?
No, those are coming from the state. So that's coming from our regional state. That report came from Cal Poly Humboldt, so I'm not sure where they got
Okay.
all the
Thank
data.
you. Thank you. And I appreciate you being here today. Thank you.
Oh, no, yeah. And that would be helpful too, because for us, like I said, we have to also for our region, these our regional programs generally nowadays, we have to show that there's enough pipeline out there sustainable for us to bring it up and have it go forever, or as long as forever as possible.
What do you mean by enough of a pipeline?
So I would need to show, like, let's say for PTA, that's our most current one we brought up, and that one is based on a regional model also. We have 24 graduates every year, so I have to be able to say in our region, 24 people most likely could probably find employment or within scope. So this is a regional program because so the region's a little bit bigger in our county. Because if I just said Mendocino County for, like, say for Psych Tech, I'm not Psych Tech, PTA, physical therapy assistant, I'd never be able to say 24 people in Mendocino County would find employment every year, or even in Lake.
Right.
So I needed to, that program we did on a regional level, so another school did not get a program because it came over to us. So in our region, 2 schools got programs for PTA, sorry. Yeah, because that's what it is. You have to show every year the cohorts can always find employment. Otherwise, for us to get tenured faculty who have contracts that are perpetual, it doesn't really make a lot of fiscal sense.
So am I hearing you saying, if you don't mind me putting words in your mouth that you haven't said, that at this point it doesn't look feasible for Mendocino Community College to start a Psych Tech program because there's several other job titles such as LVN and RN that would suffice when we open up our new facility? Is that what you're saying?
I would think that most likely, yes. I mean, I think eventually we might be able to get a Psych Tech, you know, if there was enough demonstrated demand in a region. We'd have to do the regional, because our county won't, I don't think, have enough to justify it alone.
So is our LVN program thriving? I mean, is it always going to be here?
Yeah, that's why we're bringing it over to college.
And so I'm looking at Dr. Miller on this one, with the LVN title being legally eligible to do the same thing as a Psych Tech, do you agree with everything that's been said here? I mean, the legalities of staffing our new PUF unit next year, do you think that it's feasible to staff it with LVNs instead of Psych Techs?
It depends on what the facility will pay. I think it's, even though we have a good LVN program, it's still hard to find LVNs. It's hard to find RNs. And I know our RN program gets tapped out every year, and you guys have a wait list for individuals that want to go from LVN to RN. And so I don't know how many people graduate every year with their LVN, but I know that there's, I hate to say, but there's competition with the local health setting of people not having enough nurses. So yes, an LVN can fit in for an LPT, but I do not know that we have enough LVNs even in our community. But I get where you have to have that regional model for the LPT, and that's a concern.
Do we have any idea how many positions, LVN or otherwise, or a Psych Tech, let's say, will be needed for the PUF?
I don't have it off the top of my head, but there is a staffing ratio requirement, and it is 24/7.
Right,
So,
I heard the 20,
yeah.
awake, you have to be awake.
Yeah,
too.
Yeah, someone, yeah.
You actually have to be
Which is
awake.
good, which is probably helpful.
Yeah.
It's probably helpful.
But there's a staffing ratio.
There's a staffing ratio that's based on number of patients, and so number of beds, active beds at a time, just like anything, there's a ratio of how many staffing, what type of staffing you have to have on based on the beds in your facility.
That would be an important number to know, yeah. I mean, is there any rough ideas? It's not one-to-one, I mean, I would assume, but,
We can ask that question from.
Yeah, I can pull it up, I just don't have it.
okay, yeah.
Hi, can I have my hand up, is that okay?
Darcy.
Thank you. In the hospital, on the floor, an RN to patient ratio is 4-to-1. I don't know what it would be in a psychiatric facility. But my main comment was, these programs don't graduate in a year. I believe both programs, medical assistant might be 9 months, LVN's probably 18 months to 2 years, and the RN program, Tim can answer that, but I believe that's close to 2 years as well. So it's not an annual graduation, it's a graduation 18 months to 2 years.
So for LVN and, well, for at least for RN, 'cause that's the only one that's one we have right now at the college, it is an annual graduation. We have multiple cohorts. And so it is a cohort based, of course, these often is a 2-year program, but we have 2 cohorts going, yeah, that would be 2, yeah. 2 cohorts going all the time, so one graduates every year. And so LVN, I think, also practices the same, so they have multiple cohorts at a time, for they always have an annual graduation. And that would be our goal, to have the LVN at our school. We already have the LVN to RN bridge program.
And I believe theirs is 18 months because there's some federal requirements on the public health side of the house where ours have to have the 2-year program to get the enhanced rate for billing, but our program locally is 18 months.
Well, I have to ask this question.
Sure.
So, what would be the advantage to wanting to staff it with psychiatric technicians? Is it the cost of the position, the salary costs? What would be the advantage of going that route?
I mean, I don't know. I think for an LVN and a psych tech, wage-wise, I think those are similar wage positions.
Huh.
I mean, nurse makes, an RN is much more.
Yeah.
I couldn't imagine fiscally trying to do it with RNs. But LVNs, I think, and psych techs are closer in wage. That's just from wage change I've seen, but I don't work in the sector, so.
Life and psych tech are trained more onto the mental health side of the house and psychiatric medications, and that's why the state hospitals and the prisons, they use them specifically because of the psych med training that they have.
Joe's got her hand up. Joe?
I was just wondering if we could call one of our providers to find out what their requirements are, how they staff. By observation, they always seem to have a social worker there and a psychiatrist, and then there's nursing staff. And I don't know what their titles are, but there seems to be 4 for a hospital that has 16 beds. I'm just counting from observation. Is it something we could call like RestPad and ask the question?
We can pull the federal regs, Joe. There actually are regs. I don't have them right at my fingertip, and I don't want to misquote them. But there are federal regs that say, here's your staffing based on your number of beds. So we could pull those and bring them back.
Cool, thank you.
Any other questions? And if anyone knows funding, because this is the other key to it, like I kind of said, funding for all of us is always a key point for Allied Health. For all of our programs, we had to rely on outside funding to support them for a while. And so if there's any way, if anyone knows opportunities, we're always looking for that too, because that could spark for a couple of years.
Outside funding for the instructors?
It's usually to pay for personnel. Because usually if psych techs, I don't assume it's similar to all the others, so it's the instructors and the part that, for us, like for her paramedics, for instance, it's not so much the paramedics instructor, we have wonderful regulations and agencies outside of community colleges that regulate many agencies, especially in healthcare, and they rely on things like having a director of a program and possibly an assistant director of a program. These are all management positions that are on top of an instructor. That's usually for us where it starts falling, that's where we start flipping, and it becomes, the instructor parts we can pay for usually.
Self-supporting.
Yeah, so like for nursing, it was getting a director of nursing, or for PTA, it was getting a director for PTA and an assistant director for PTA. Is the parts we have a hard time funding ourselves, but you can't get approval from the state regulators if you don't have those in place first. So like LVN, as it's transitioning over to our college, even before for a year or and a half, before we even have the first student on campus, we're gonna have a director for LVN, because that's what the state requires us to have first, before we have one student or one curriculum or one anything, and that's being funded through other funding, not our general fund.
Okay, I just want to clarify, because this is not my field. So Mendocino College, again, those programs that you listed, none of them will produce a certification for an LVN?
Right now, that's at the adult school.
Oh, right, you said it's gonna move.
Yeah, so it's moving to us. So right now, yes, you just have to go to the adult school to get that certification.
And I thought you threw out a number regarding how many LVNs are currently participating.
Oh, I did RNs, because we have nursing. So for us, it's 24 to 28
Nursing.
in the cohort.
No idea about the adult school, how many LVNs?
I don't know the adult school numbers.
Yeah.
I assume it's that or higher, because usually sometimes the ratios can be actually higher in those programs. Because the RN's probably the most restrictive program you could have because of the clinicals and things like that for things like CS here.
Who runs the adult school?
The adult school, there's multiple in our county. This particular program is run through Ukiah Unified currently. I sometimes, MCO has a couple of the healthcare pathways. They have phlebotomy is through MCOE, but the MA and LVN are through Ukiah Unified right now. They're adult school.
Yeah. Thank you. Any other questions? No?
Thank you very much for
Sure,
taking
yeah,
the
and
time.
if
really,
you have
thank
like
you.
a staffing thing and you want us to map like for all your positions, like if you need a social worker, we could say, we have this, please talk to this instructor or talk to us because we could try to find you a social worker, or if you need clerical, all that stuff. Because we want to try to get all your positions filled with the talented people you need in our county.
I have one more quick question.
Yeah.
So LVNs meet the criteria legally of being a psych tech. Are there any special classes that they have to take? And the reason I ask is this: if you go back and you look at the history of why our PUF closed in January 2000, it was for two reasons: money and staffing. And I don't know if the LVN almost loophole was there in 1999, 2000 when a decision was made to close it. So I don't want you to leave with us having a false impression that we can just not hire any psych techs unless that's the case, and only hire LVNs and RNs. I mean, is that the case?
If we can get them,
If we can get them.
we can get them.
Do you know what the hiring ratio is of when the adult school graduate LVNs?
I don't.
Are there jobs waiting for them?
Oh, there are jobs out there.
All right,
LVNs are in high demand
high demand.
in our region, just like CNA. Anything in healthcare, if you put healthcare, allied health on a job,
Mhm.
yeah.
All right, thank you.
All right.
Thank you very much.
Thank you.
I'm always happy to come back too.
All right.
Well, thank
Thanks,
you.
Tim.
Yeah,
Thank you.
yeah, no worries, no worries.
So my question is, do we need an agenda item for the next meeting to follow up with this in any way? I mean, personally, I would think that it would really be helpful to have a staffing list. So, yeah,
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 Yeah, I'll bring it up.
okay.
it means the brains of the outfit. She
Yeah.
can figure this out, right?
Okay, great. All right, then, let's move on, yes?
Thank
Do
you.
want me
Thank
to
you so
email-
much.
Would it be helpful for me to email someone also my presentation where you can have it?
We need it for the minutes anyway, so
Oh,
yeah.
I think that would be nice.
I will.
The other question is the college even entertaining this at all?
Entertaining.
Starting the program for the psych tech?
Where we're looking at right now is leveraging Napa Valley to get us started.
Okay.
Yeah.
All right. And then we'd be looking at money from there.
Well, even with that, I'll be looking for money. We're always looking for money. Everyone's always looking for money.
Let's take that.
Yeah, everybody's looking for money, that's for sure.
Sherry Darcy has her hand up.
Oh, Darcy? Thank you.
No, she's shaking her head no, she just left it up.
Oh, okay. All right, well, thank you so, and you're gonna email that to,
To me.
To you?
Claudia.
And you're the one who emailed
Yeah.
me? Okay, then I've got it. That's really cool.
and Claudia, will you send it out to the committee then?
Yes.
Great,
Oh,
thank you.
Cool.
All right,
Thank you.
Thanks so much.
Thank you.
Thank you.
Sure. Thanks.
Sorry I missed out.
Oh, no, if you want to just talk me too. Just come on
No
by.
worries, thank you.
Sure.
Okay, moving on to item 3C, the November 2024 Measure B financial report.
That's me.
That's you,
So,
Andrea. Okay.
so good afternoon, everybody. So I wanted to apologize for the oversight on my part regarding part of the report. The November detailed monthly report was missing, which I had provided to the members that are here, and also up front if additional copies need to be made. The numbers are in the report, it's just that detail part was missing. And I will ensure next time that it does not get missed. So I also included the final 23-24 end of the year report. So just wanted to touch base a little bit on that. The revenues that we received were 3.6 million. And that's including our sales tax, our interest, and any Redwood Valley Training Center rents that we received. So that whole total was 3.6 million. The expenses were 2.19, and that's including all the PUF costs and our operational costs that we did in-house. And then for the November one, it's on the expenditure report, but it's harder to see. Just I wanted to give the revenue that we've received so far is about 407,000, and that's for just 2 months because it lags 2 months. And then the expenses right now for the PUF and operational are about 1.4.
We're not still paying for it to have the parking lot swept every 3 months or so, are we?
At the
The training center,
um,
Sonoma sweepers.
I
I
Don't-
think the janitorial should be taken care of.
I
now.
Well,
think
we
the
were paying a lot of
janitorial-
money, it was ridiculous,
Yeah,
because it never gets used, so.
That's part of the buildings and grounds.
Okay.
yeah, I don't for this year
If it's not being done regularly, we can follow up with it.
I haven't looked at the facility bills in detail this year. They don't seem, because somebody else does that, but I could take a look and see. But I know that it's very limited. I don't think the facility bills, I don't know if you've seen it.
Thank you.
Kristen sent them to you, I'm not sure. I think we're just now getting facility bills, so, because they're always a little bit behind.
Right, okay,
So, but I could take a look at that.
thank you.
So if there's any other questions, you can email and let me know. I'll put a note to look at the facility.
So were the 23-24 budgets closed? And so the numbers here are as good as gold? Thank you.
Yes. We got everything in and
If I may, this is Sarah. We are still technically in audit. We will not receive our finalized audit for the county until the end of December. But as far as we can tell right now, there are no changes.
Thank
Yeah.
you. No surprises, thanks.
from when we received expenditure and revenue wise that I can account for, it's what it is, unless Sarah has different.
All right.
I guess this might be a good time to ask this question. and I think I'm not sure who it gets directed to, but it's about our prudent reserve. And when I worked in a school district, we had a prudent reserve that was based on the annual expenditure budget. So if it was a prudent reserve of, let's say, 10%, just to use an easy number, and the budget was 20 million, the reserve had to be $2 million. In the following year, the budget changed, the 10% was constant, but the reserve amount, since it was based on the expenditures, changed. And Measure B has, from what I see, operates differently, that the reserve is based on let's see.
Can I add?
It's the fund balance, yes?
The
Yes.
6.85% of the fund balance.
Right, thank you, of the fund balance. And so however much is left at the end of the year, 6.85% of that, the following year, whatever's left. And so the reserve grows, unlike a school district budget where unless the expenditures grow, it doesn't grow. So my question is, at what point do we stop adding to the reserve? That's the first question. And then the next question is, at what point do we try to, or do we try to spend down some of the reserve? So it's two questions. And I'm not sure who answers that. But I've wondered about those
Can
questions.
I just make a comment,
Absolutely.
please? And granted, I work from the private sector, not the government sector. Number one, you don't spend down your prudent reserve unless you need to spend down your prudent reserve. And you always add to the prudent reserve because in 20 years, when the PUF needs a new roof, it's gonna cost 3 times as much as it's gonna cost now. That's what your prudent reserve is for. Is to come, at least in my opinion, this is my opinion and my opinion only. Your prudent reserve, if you own a home, you have a prudent reserve in case you need to fix the roof, in case you need a refrigerator, all of that stuff. And I tend to lean on the conservative side, and you always want to be able to keep that building and keep it running well. And I'm going to shut up now, because I was going to say Mendocino County has a very bad habit of putting off deferred maintenance. And that's when you run into trouble, in my opinion. So the prudent reserve, if you remember many years ago, and you might not have been on here, I actually wanted more of a percentage, but that's beside the point. My opinion is you don't spend down the prudent reserve. The prudent reserve is there to make sure the buildings are always maintained.
Okay, so let me follow that up with a question. Janelle Rao, I think she's no longer working here,
No.
is she? So when she worked here, she gave us a terrific spreadsheet that addressed these deferred maintenance issues. And isn't it possible to budget for that separately from the prudent reserve? Budget for deferred, for the 3 facilities, because she, in her presentation, that's what she did. She had one for each of the annual costs, deferred maintenance for each over 20 years. So what if that was budgeted? Then how would
So
we
I'm
feel
going to ask
about-
a county question, if I
Okay.
may, to county people who know. Isn't it the same thing? Prudent reserve is for your maintenance.
No, not
And
always.
not always, not always.
There's a
I
lot of
understand
unknowns.
that.
I mean, when we
But-
set this, there were a lot of unknowns.
Yeah,
And we have 10.2 million in a prudent reserve. We have a full agenda today. I'm not, if someone's concerned that we don't have enough money in the prudent reserve,
I'm not.
please, I'm not. We need to, I honestly, we have a lot of money in prudent reserve because we were very smart when we set it. So we have 10.2 million
Well,
sitting.
when we're trying to we're at the point though where if we're trying to put together a plan, let's say a long-term financial
Then
plan
that needs to be on the agenda.
fine.
honestly.
Okay,
Thanks.
good. Thanks, Tom. Okay, moving on. Item 3D, update and discussion regarding Measure B related items at the Board of Supervisors meeting.
So that's me.
Oh.
So the Board of Supervisors at their last meeting requested, and it's on this agenda, us to look at looking at funding substance use disorder treatment programs again. So later on, we'll discuss that there's an item looking at, do we want to do another RFP for substance misuse treatment?
Okay. Is that it?
That's it.
Okay. Item 3E, update and discussion regarding the status of current Measure B projects.
All right, you guys have a report of the current Measure B projects in front of you. And if there are any questions that are not answered in that report, we can answer it. I do want to know, I think there has been a couple comments with misinformation that we got 9.3 million. We didn't get 9.3 million. We were awarded 9.3 million, but we have to bill for it. So we actually do not have it in our coffers. It's a requirement through the grant that we bill, and if they approve the charges, they will reimburse us for those. We sent up our first expenses, and we expect
The amount that we sent
Yeah.
out, it was 1.3. Yeah, about 1.3, and that's if it gets approved.
if it gets approved. So we're waiting. This is our first upload into their system, and we're waiting to see how that reimbursement goes for the 1.3. So we'll have more details at the next meeting.
Hopefully, at the next
Yeah.
meeting, we'll know.
Is the expectation that we will be able to bill 9.3 million?
Yes. The expectation is we will be able to bill 9.3 million, but
Right.
everything we bill has to be approved on
Right,
that, on
right.
their end, to make sure that they're agreeing with the expenses.
To their terms, yes.
Yes.
Yeah.
And that's the only updates I have, Sherry.
Okay, thank you. 3F, update and discussion regarding retiring the phrase Measure B. I'll speak to this. I wrote a letter to Katrina Bartolome. Briefly, it was as chair of the Measure B Citizens Oversight Committee, I'm following up on action taken by the committee to request you consider retiring the phrase Measure B, excuse me, for any future ballot measures. The Mental Health Tax Initiative has become synonymous with the name Measure B. It is for this reason, and to avoid any confusion with future ballot initiatives, that we make this request. So that's the letter I gave to her. And I actually spoke with her yesterday about this, at which she told me it's not possible, that the county uses a rotation of letters for the measures. She said some counties begin with A every election. We don't. And I asked her, what letter are we currently on? She thought we were on Y or W. I think it was one of those. I said, so then Measure B would possibly come up soon. She said yes. She said she's not allowed to do that.
Okay, great.
Okay? But, so that was followed up on.
Thank you.
You're welcome. Item 3G, discussion and possible action regarding a request for proposed RFP for substance misuse projects.
So that's what I just spoke about. There is, as you know, 10% of the measure is supposed to be used towards substance use, misuse. That was something that was in the Kemper report and what we had agreed upon. And so I think the request from the Board of Supervisors and myself is to talk about, are we ready and can we approve moving forward with another RFP? We did one RFP that got sort of put on hold pending the psychiatric health facility and the need for the jail project. We now know that the grant seems to be going through and we will be getting reimbursement. So I think we need to relook at relook at this. I think we need to put out a new RFP focused on substance misuse.
100%. I mean, especially with this $7 million thing that the county's not borrowing money on. I mean, we have money, and let's do an RFP for substance abuse.
So are you making a motion?
I'd gladly make a motion.
Well,
But when we did our motion for RFP for the PUF, that was oh my gosh, that was a several-hour discussion. So I don't want to blindly say, let's put out an RFP. I think that we need to listen to what needs to be said. I mean, here's the problem, Janine, is when the RFP went out for the PUF, really and truly, this committee was kind of left in a blind of what we were asking for, because it was done by you and some other people, and we just entrusted you to do it. But I think that it should be a very open meeting to talk about what we're going to do. Is it alcohol? Is it opioids? You know, is it going to be in the north part of the county? Is it going to be in the coast? Is it going to be Ukiah? There's a lot of questions before we go to the RFP, but I certainly would make a motion. I don't even know if we need a motion to put it on the agenda for next time, that we can have this open discussion and to get some of our questions answered. Does that make sense?
It does. We just have to realize putting out an RFP, we can't dictate 100%, or we may get no one that applies.
I get it. I
think we have to
understand.
make it broad enough to look at what are the options for treatment providers and have prefaces of, like, we would prefer to have A, B, and C. But I think we need to see what providers we have that are to apply.
What are your thoughts? You're the doctor of this.
Looks like Donna has a
Sorry.
question. Yes.
No, and I may be totally off base. I totally agree with Tom. And this is probably an extra step that doesn't need to be done, but there's another one besides the RFP that goes out, RFQ, right?
Request for qualifications.
That they will tell us what they can provide.
Correct.
And I don't know if we want to do that. I'm just throwing it there. That's interesting.
So is it true that Ford Street has been funded by a tribe?
I cannot speak for Ford Street 100%. I've heard that they may have gotten some funding through Northern Circle, but I think Jackie would be the best to speak for that. I don't have that information. It's just hearsay.
She probably wouldn't want to come back to one of our meetings because we've told her no so many times. But now that this new information is here, I think that we're in a much better position to say yes. Or at least, let's talk about it.
Right, and I think we need more options. So I think whether it's, Jackie being willing to look at expanding or needing the funding still, or whether or not we have Turning Point and DAC, who has been looking at potentially coming into Mendocino County.
Is that a private,
Yes.
for-profit?
I think they are for profit.
Turning Point and
Turning Point, yeah.
And who are they?
They're a local, well, I wouldn't say local, they're local to Sonoma County. They're kind of throughout most of this. They have facilities, they do medical model detox, residential, outpatient. They will focus on dual diagnosis treatment. And, but they just built a huge facility in Santa Rosa, which is doing medical model detox, residential, male, female, and then they also have outpatient. And the nice thing is they can do dual diagnosis because they bring in psychiatry, so they have that piece as part of their model for treatment.
What's their name again?
They're called Turning Point.
Turning Point. Wow.
Medical model detox, is that also known as methadone?
No. It's a detox, but from a medical model. So they have, so there's two types of detox, right? It's a social model detox is what Ford Street does. Medical model means that you're being overseen by a physician in more of a medical model setup. So they're helping you get through your detox with medication support and stuff like that.
So if we get to the point of trying to write an RFP, people are going to respond if they based partly on how much money is available. Yes? So don't we have to have that amount in mind?
We should have an estimate, but some people will have their own. I think we should have an estimate.
Okay. Okay. Anything else?
Darcy has her hand up.
Darcy?
Hi, thank you. I support Tom's idea with going out for an RFP, and I would support the idea of bringing something back to this group that lined out maybe 3 to 5 priorities that could go on the RFP.
There you go.
And then let the other, maybe those responding can bring other things to the table, but at least this group would have a handful of items. that are their priorities. And I would suggest location too, whether, inland, coast, north, whatever, maybe one each area. I'm just throwing it out there, but just some thoughts.
So would that fit under our agenda item next meeting, the open discussion portion?
Can I add one more thing? And then something that it works for youth as well. If we could also discuss that at the next meeting as one of our priorities for substance use.
Oh. Okay. Yeah, moving on. Yeah. Item 3H. Update regarding the loan of Measure B funds for construction of the county jail behavioral health wing.
So Darcy, do you want to speak about that?
I can start, but I'll pull Sarah in. So, due to the great work that our acting auditor, controller, treasurer, tax collector, Sarah Pierce and her team have done, we have a better look into our finances. And it was voted on by the board earlier this month to return the loan, the $7 million back to Measure B. On the timing on that, I'll leave that up to Sarah, but that is definitely the direction. So you will have your money back here shortly, and that should help you move forward the RFP for the substance abuse of what you were just speaking about. We're pretty excited. The executive office, along with Sarah, really wanted to make that a priority to get back to you all. So, Sarah?
Sure. So in September, the Board of Supervisors did approve the funding of the $7 million, but I had not yet withdrawn the money from the Measure B funds, so the money is still sitting in the Measure B account. I was planning on drawing it down in November, but with closing the year and expecting the carry forward that we have, I am not going to make that withdrawal. So it will continue to sit in Measure B's fund. Like I said earlier, the audit, we should be receiving our draft audit this week. I'll have a better idea if there's going to be anything changing, but as of right now, it looks like our carry forward for the county is covering the Measure B funding.
Wonderful.
So Sarah, we didn't get our 2% interest on one payment? What the heck?
So there's, I've not taken any money out.
I know, I'm
Keep
just
it back to
being.
the board.
That's why I had wanted this on there. I thought it had been transferred, and what about our interest, if it was
No,
coming back?
it was approved in September. I was planning on pulling it in November.
Yeah.
That's when we were expecting to need the funds, but we
Great.
are not, but knowing that we have the carry forward, I'm not going to pull it.
Great, thank you.
Thank you.
Good news.
We lost 2%.
2.5. Okay,
It was technically 2.5.
yeah.
I was cutting you a deal for not pulling the money.
Well, I had calculated for 2.5 months that 2.5 on 7 million was a little under $37,000. But I'm glad it was never moved, so great.
Yeah, congratulations on finding that. I hope
Yeah,
the audit shows that it stands, because that takes a little onus off of all the craziness we've been
yeah.
dealing with. Thank you.
Thank you.
Okay, item 3I, discussion and possible action related to funding Fort Bragg Care Response Unit.
I want to make sure, Justin, I think Cervenka and I don't know if O'Neill are in the waiting room.
Cervenka and Tony Norville.
You can add them. I don't know if Bernie plans to speak, but I would add him just in case.
I have a pretty strong opinion on it.
Okay,
They haven't
Oh,
spoken
me.
yet, Joe. Hold on.
No, okay, there's Neil.
I gotta get Nell in here, and I think Bernie's being added in case he's speaking on this too. So let's get them added, and then I will
Bernie can
introduce
call
it. Huh? Bernie
Bernie
declined? Okay, so I think it's just Neil. All right, Neil.
Yes, I'm sorry, Neil can't be here. We're dealing with a bomb cyclone, an atmospheric river, and he's the emergency manager.
Not a problem. So there is a request from the Fort Bragg Police Department for us to fund their care response unit. They will be running out of funding. They've been, and correct me if I'm wrong, Neil, they've been operating on grants, and their grants are going to come to an end in May of 2025. And they are requesting if we could fund this project for a 3-year period at $250,000 a year. They are planning to continue to look for grants and look at other funding streams, but they really don't want this program to come to an end in May 2025 because it's been beneficial to their community, and so they're hoping we'll consider this. And Neil has more to add about the program, I think, and if you guys have any questions.
I have a short presentation to share. If I can. Alrighty. Can everyone see the slideshow?
Yes.
Alrighty. So, CREW began as a crisis unit for the homeless, and it was funded through Behavioral Health Justice Intervention Services grant. We provide mental health follow-up, so it is a field-based system. We are not social workers, we are not mental health providers, we are not substance abuse counselors. We go out to the field, find people, and connect them to the already robust services that are available in the county. But oftentimes people have difficulty making appointments, filling out forms, and conducting the follow-up that's required. So our team goes out and makes sure they connect to the right services, and then they follow through with those services. We moved into addiction services with our project right now that I'll discuss in a little bit. We focus on ego development. There's a book called Reframing Poverty by Eric Mead that compares the sociology of social classes with the psychology of ego, and discusses how if one's ego isn't developed to a future thinking level, they will have great difficulty pulling themselves out of the lowest social classes of homelessness. We're also operating the extreme weather shelter through an HAP grant from the county. Last night we had 20-ish people in the shelter, and our crew team was out today in the field finding everyone that is out on the street and making sure that they knew about it and could get in tonight. They co-respond with police officers, but they also self-dispatch. So they'll go out, they'll review the logs and see where the mental health calls happened and where the substance use calls happened, and then self-initiate those contacts, trying to get those people out of the criminal justice system. So right now our crew team includes 3 people. You can see their education and backgrounds are quite varied. Our last addition is Melissa Johnson. She's been with us for about 2.5 months. She has a bachelor's in government, which is interesting to be in this line of work. She did mission work in Latvia, where she worked with prostitutes and cared for them and got them services, and it was a wonderful experience to be able to bring that back, that international perspective, back to Mendocino County, and understand that everyone suffers the same issues everywhere in the world. Just last year, CREW's been in existence since about mid-2022. We took our statistics from last year because it was the first full year we've had them. They served over 300 community members, with 112 of those clients receiving multiple rounds of services. Part of the substance use plan is they walk them through the process of getting into rehab. There's a process you have to do an intake, and our team will be with them and support them while they do that. And then we also offer that transport to rehabilitation. And it was interesting that you're talking about funding a substance use for the coast, because right now we're transporting all the way down to LA for juveniles, which is very time consuming and expensive. Last year they reconnected 21 homeless individuals with family and friends elsewhere. They attend behavioral health court every week and help their clients stay on track so they can be removed from the criminal justice system and attain a healthy, happy lifestyle, with medication, with substance use disorder treatment, with job training, whatever it takes. They're moving around and serving the individual. They develop those rapports with all of our clients, so we can do warm handoff with the service providers, specifically in the county. And then we are connected with the district attorney, public defender, and probation to pull mental health and substance use disorder cases out of the criminal justice system, out of jail, and move them into just normal society. So comparing 2022 to 2023, our calls dropped by 13% for calls involving the homeless, which is a fairly dramatic drop. And then breaking it down by month, we used 2018 and 2019, and then 2023 and 2024, because we had those COVID years, and the pandemic just really skewed stats all over in the police world. So you can see the 2018, 2019, they were hovering between 50 and 60% of total arrests were of the homeless. And right now in 2024, we're about 18%. So that has been a tremendous drop in the total percentage of arrests of homeless. And that's the total number of arrests, and then how many of those people were homeless. That's how we get that statistic. So we're tracking statistics a little differently than other people. They're a little more tangible, and they're more visible. Comparison of yearly averages from 2018, 2019 through 2023, 2024. You can see that trend is dropping dramatically, indicating the success of the program, in our opinion. We started Project Right Now on a youth opioid response grant, which that HCS has asked us to reapply for. We were the only law enforcement agency awarded that grant for youth opioid response. We work with education, prevention, and treatment. And the schools are a great partner in that. We've spoken to every high schooler and middle schooler in Mendocino and Fort Bragg. The education includes Narcan training. So our overdoses are dropping in this area, but we're not sure if it's really dropping or if it's because they're getting Narcan and not reporting it. So in 2023, we assisted 24 people into rehab. In 2024, year to date, that's 31 people to rehab. Some of those self-transport, some of them just need our assistance filling out the paperwork, going through the process, and they get themselves to rehab. And a good chunk of those people we're actually transporting. And the unique thing about the program is we're working with the courts and the jail, and we're taking people from jail directly to a rehabilitation facility and removing them from the jail, which with Medi-Cal, it costs about $60 a day for rehab. It costs about $120 a day to keep somebody in jail. So we've seen great success with that. A lot of those folks are staying stabilized, moving into sober living facilities, and getting jobs and re-entering society, moving them out of the continual cycle of jail, which is where most of them do not belong. That concludes the presentation, and I'm happy to answer any questions you may have. And let me stop sharing.
Chief, I this is Tom Allman. I appreciate what you're doing over there. Do you travel outside the city limits at all with your team, or no?
Yes, so Melissa is funded through a Prop 47 grant that we were awarded in cohort 4. They are now working down to Mendocino, and we've expanded out. We're working with the sheriff and his deputies to identify folks in Mendocino and outside Fort Bragg, primarily on the coast, to offer them the same services for crew, connecting them with resources, helping the deputies with their high volume repeat offenders.
Thank you.
Joe?
Muted.
I try to be not rude. When you say you take these people to facilities, where are you taking, I mean, you mentioned the youth are going to LA, but you've got a lot of adults. Where do you take them?
Most of them are going to Humboldt. There's a couple of treatment facilities up in Humboldt, so it's a full day travel for our team to drop them off. And then there's also the continual care and the wraparound care that we provide. So in one case, a gentleman was 60 days sober, and he earned the privilege or the ability to visit with his children. He got a 1 hour visit with his kids, but he had no one in this area that was able to drive his kids. So our team drove his kids to the rehab so he could visit them for an hour. And that was a 7 or 8 hour day for our team member, but that gentleman is reunited with his children, working and sober. So those little things we do greatly impact lives, and it'll impact the kids' lives and their kids' lives, and it moves forward from there.
So just, this is a very pointed question. You're talking Humboldt, is one of those facilities stem from Byron's, or are these separate facilities from that one?
I haven't heard that name.
Okay, just curious.
Yeah.
Chief, you're asking for a total of $750,000, $250,000 for once a year for 3 years. Can you
Yes,
explain
sir.
those costs?
Yeah, so that is just pay and benefits so $250,000 covers 2 of our crew team members. The 3rd crew team member is funded for 4 years through the Prop 47 grant. Our funding on the current grant cycle ends March 31st. So beginning April 1st, 2 of our crew members are no longer funded. So the 125,000 is pay and benefits, fully burdened.
And can I assume this is a reimbursable request? So if you have a vacancy, that we're not going to send money there? Is that fair?
Correct.
Okay.
Yes.
So why only for 3 years? What would happen after 3 years?
Honestly, what would happen after 3 years is we would ask again. I put a 3-year limit on it because we don't know what's happening with the state right now, and as far as funding streams and budgets, we want to continue this forever.
Yeah.
But oftentimes it's more palatable to have a 3-year project where I can come back and show you 3 years of data, what it's done. If we're requiring additional funding past that because the state has not come forward with funding for projects like this, we could then reapproach the committee for an extension.
So I'm going to ask what I think is kind of the obvious question. You're in the city of Fort Bragg. You've got the city of Fort Bragg insignia behind you and on your chest. What's happening with the city of Fort Bragg? They just upped their bed tax, and so they're looking for more money. They always are. And have you approached the city of Fort Bragg?
So, yeah, we finished our budget we finished our budget last year with $46,000 in the black and the green. Funding this would be It would prevent that, those taxes are being used for general services, streets, roads, public safety in general. The police department's gonna need to expand. And this project with crew impacts the entire coast, not just the city of Fort Bragg. We deal with folks from all over. They come to Fort Bragg because the services are here when you live on the coast. So right now the city's not in a position to fund it out of general fund.
So, do you have numbers for the people coming from outside Fort Bragg city limits?
It's generally about 10 to 15%. That's going to change though, because we just started the Prop 47 grant, where we're expanding down to Mendocino. So that's the whole function of crew is now expanding out, so we're going to have more clients that are from outside city limits. And we just don't have those numbers yet.
Chief, I'm very supportive of this, and one of the things I'm going to ask when I make the motion is that your department send us at least quarterly stats on how you're spending the money.
Absolutely, very easy to do. We keep stats on everything.
So I have a different question. It's not about Fort Bragg in particular, but I'm curious, do any programs of this type exist elsewhere in the county?
Yes.
Yes?
The county started a CORE program, which I believe stands for Community Outreach, Response, and Engagement.
Yes.
It's a slightly different model that I believe is more dual response with law enforcement. Our team doesn't do a lot of dual response. They do a lot of response without law enforcement because they get better. They're received better by the community that way. CORE is a successful model throughout many areas. But as far as one identical to crew, we have not found one identical to crew yet.
Darcy has her hand raised.
Darcy? Oh. Darcy?
Hi.
Yeah.
Hi, Neil. How are you, Chief?
Good. Hi.
I would just want to ensure we're maximizing all the funding sources that could go into this, whether it's partnership health plan for transportation, other programs that these folks might qualify for to help you fund your efforts. And then data, I would like to see outcomes if there's a way, I know you track them only so far, and that's kind of limited for some of us, right? Especially when they're transient and they're moving, it's harder to track them. But if there's some outcome data, I think that would be valuable as well.
And Joe had her hand up.
Joe?
You're on
You're
mute.
muted.
Sorry, somebody needs to shut me up once in a while. The question I've got is, the Sheriff's Department wanted to borrow money, and we then agreed to loan the money, and we were going to be paid back interest. You're just asking basically for money to run your program. Have you thought about whether you would be paying it back?
No.
Or interest? You're just got your hand out. I hate to say it this way, but basically you're dipping into the till. Not that I don't think what you're doing is great, and you know that, we've talked. But my fear is, if you as the city of Fort Bragg come and say, I want this much money for this program, then Ukiah's gonna wanna come up and say, I want some money. Point Arena, Willits, they're all gonna say, you've got this pot of money and we'd like to dip into it. And Measure B in my way of thinking, is a county measure for county services. And this is the city of Fort Bragg making the ask for the city of Fort Bragg. Yes, I understand you're going out to Mendocino, but, and I think what you're doing is amazing, but this money is earmarked, and right now we have created a couple of the things that we wanted. We have to do training still, and we're building a facility that we're hoping to have open in a year. And that's got a lot of money going into it, and we don't know, what's gonna be happening. But that psychiatric hospital is gonna be twofold. It's gonna have NAMI offices in it, which your people can partake of, and then it's gonna be a psychiatric facility, so if you're dealing with a psychiatric problem, it'll be right here in the county, presuming we have, the beds are available. So some of that should be alleviated, hopefully, in the next year. And as Darcy pointed out, have you looked into some of the other facilities? Yes, we're sitting on a pot of money, but that's all earmarked. And then I would feel, when we put, this goes back to tourism, when we put the bid through, and as soon as that went through, we had a Chamber of Commerce, which is kind of similar to the city of Fort Bragg, because Chamber of Commerce is, you have to join it. It doesn't take care of everybody. And they came up and said, you've got a pot of money now, we would like $25,000. And we had to go, wait a minute, and then look at if we were gonna be able to do anything for any other groups. But no, we couldn't give somebody just $25,000 just because we wanted to. So,
Joe, can I respond?
yeah,
Okay.
you and I yelled at each other in the back.
And you brought up some valid points. However, when Measure B was passed, the voters, it didn't differentiate collecting taxes outside the county or outside the cities or just in the county. It collected taxes from the 4 cities that we have here. And
Yep.
Measure B was written for almost exactly programs just like this. And if you ask the question, what happened if Willis or Ukiah came with the same thing? If they had the same results that Fort Bragg did, I'd be the first one behind them to say, how can we make this work? So while your points are very valid, the voters passed Measure B for the purpose, 25% of the tax will go towards improving services towards the victim of mental illness. And I can't think of any initial primary service that we offer which would compare to what Chief Cervanka has done. So while I appreciate your points, I really think they're going down the correct road on this one, and I would welcome other police departments to do the same thing.
So what I was going to finish up with was when we get the psych hospital up and running and can reevaluate the funds that we have, then I think it would be safe to go forward. But I think if we've got to finish that psych hospital, and again, that's the bulk of the funds right now.
Well, if making this
So
a
I'd say open it up afterwards.
if making a 2-year commitment instead of a 3-year commitment would alleviate your concern, I'll gladly do that. I mean, anybody can make a motion, but I want to make sure the chief knows that we support his efforts and what's happening on the coast, because I've been through many meetings where I've had people from the coast tell me, why are you spending all the money inland and nothing ever gets, to the edge of Mendocino? And this is just the opposite, and I'm very, very happy about this one.
So can I throw something in here? In the past, when we in fact had a meeting on the coast, a person came forward and requested money directly from the Measure B Oversight Committee. And what we ended up doing was we said, well, it's not fair to just allocate it to an organization without opening it up to everyone. And so what we ended up doing was putting out an RFP to create essentially a level playing field. And in terms of consistency, it only seems right to do the same thing here. That's my 2 bits.
I thought, and Janine, I'm looking at you, I thought at the very beginning, when these programs were being talked about, we as Measure B offered to fund them, but then you came up with state grants that said, I know Measure B offered to fund them, but we don't need that funding because we have it through state grants. Wasn't that part of the conversation?
So we, so two things happened, right? So we funded programs that didn't have to go through an RFP. There were particular programs that we funded, like crisis aftercare, stigma discrimination, education. We funded the crisis respite in Fort Bragg. And then we did fund mobile crisis response. And then we were able to apply for a grant. And with that grant, we were able to then not need to use the Measure B funds because the grant took precedence. We were able to use the grant funds instead of Measure B. We still have that grant. We're still utilizing those funds. And of course, now there's a Medi-Cal mobile crisis requirement and funding. And so those funds were not utilized. They're still on the table because we did not use them in county behavioral health. So those were funds that would have been utilized that never were utilized. And then NAMI chose to discontinue their contract for the stigma discrimination. And so those fundings were never utilized either. So we actually have some funding that we had planned to go to programs that did not go to programs.
Right. And can I just ask, once we establish something like this, it may not be benchmark or whatever, it's easier to get grants, or am I out of the, in other words, we prove that this works, that what we're funding is working, and we can get other funds as time, and which I totally appreciate, by the way, asking for only 3 years, because if you'd have asked for eternity, I would have absolutely said no. But what do you think? And this is just a question, and I'm not going to hold you to it at all. Everybody else might, but I won't.
That's right, everyone else will.
What Donna says.
I think that it depends on what grants are out there, right? So grants vacillate between what they're wanting to focus on and where you can get them, and they can be very competitive. I do think when you have a good program that's showing good data, you have the data to apply, and you're more likely to get approved for those grants. And that's just, I've written many grants, so I can say yes. But it's also what are they looking at? What are the current grants that are available? Who else is competing for those grants? Sometimes if you're serving a special population, a minority population, you might get more priority over someone who's serving a full population. And so and I don't want to speak for NIL, but I believe that they have continued to look at grants and have gotten grants. And I think they're here because right now there aren't any grant options. And they don't want to see this program go away. So I don't think he didn't look at grants. I think the fact is that they have been looking, and that's why they're here. I think they would have, if they had other grants, they wouldn't be here asking us for it. But they also don't want to see this program go away. I think that they will continue to look at grants and apply for grants as they come. And I think the more data they have, the more likely it is for them to continue to apply and get other grants, because they'll be able to show how their program is progressing and what's the benefit of their program.
Right, and you're asking for 3 years. I don't think that's a bad thing to ask for. You already have it in process. It's not something that we're going to be starting over. In other words, we're not starting something. You've proven that it's been working. I'm assuming everyone agrees with your statistics. So thank you very much.
And I'll just throw out there really quick, because I think Neil wants to add something, but I want to remind the committee that if we looked at just the savings we've had by behavioral health, not having to use the mobile crisis funds that would have been spent, we do have savings that we weren't supposed to have in NAMI's money. So we do have money that would have been spent if it wasn't for the grant we got. So I think there is money that is available. Sorry, Neil, I think you wanted to add something.
I had another question and you might have to answer this one too, Neil. Number one, Dr. Miller, if we have money that is not earmarked, how much is it? Because we're asking $750 a year for 3 years,
No,
right?
$250 a year.
$250 a year for 3 years, okay. But the other question is, I hear you saying that you've extended this into Mendocino, which means that you're probably hitting Casper and all the other outlying areas. Is there a plan to have this go farther? Because again, you're under the umbrella of the city of Fort Bragg, and they normally keep to the city of Fort Bragg.
So the crew team member under Prop 47 will be working with the sheriff's department. Anything outside, that's a partnership between the police department and the sheriff's department. The county assisted us getting the Prop 47 grant. CEO Ansel was very kind in providing the grant writers to write the grant for this program because it was going to greatly impact the coast. When we look at population densities along the coast, it's really Westport to Mendocino. They can go a little further, but there's a logistic issue of sending a crew team member down to Point Arena, especially if they're going to be by themselves, where it'll be a long time before they could get assistance should they need it.
I would think it would go to the Navarro
Yeah, that's
at some point.
At some point, yeah. The idea of it just being Fort Bragg, we don't have a patent on this. If this wants to be, if other agencies want to do the same thing, that we're absolutely willing to help. As far as the grants go, yes, we are seeking a youth opioid grant again. We've been able to apply for it, but again, that is a very small segment of the population. It's ages 12 through 24. And as we all know, there's a lot more substance use disorders, 24 or 25 plus. So we absorb those into the regular crew program, so no one is turned away. But we continually see grants. We know this should be a good grant process. We're continually seeking, but as Dr. Miller said, the grant we got 3 years ago doesn't necessarily exist now. They've changed their projects or their guidelines or their focus to something that's much different that wouldn't meet the needs of our population. So that's, we love the grants. The city survives on grants, but they're challenging to get when they're competitive grants.
So there was a question, Sherry, I just want to answer Joe's question. So on the table that behavioral health left because of the grant that we got, there's 1.1 million that behavioral health did not spend that was allocated to behavioral health. In regards to the NAMI contract that didn't get spent, there was 1.2 million not spent by NAMI. So even just looking at behavioral health, not looking at the NAMI, because we still may want to look at that at some point. I still think it's a really good program. We have 1.1 million that would have been spent if I hadn't got the grant I got. So it is money that's extra that we didn't originally plan for, and I think that more than covers what Neil is asking for.
So the comment I made about 5 minutes ago, I haven't heard any response to that. I still sit here and remember when Jackie came before the committee asking for funding for Ford Street, and it was said that no, in the issue of fairness, we need to send out an RFP and open it up to everyone. And I don't have any doubt that this is a wonderful program. That's not the issue. It's more doing things, having the right protocol, I guess, which it just doesn't, it feels like, I don't know, am I the only one that feels that an RFP should be sent out in relation to this, or not?
That was one of my questions that I was, had thought too, that, because I know we were talking substance abuse RFP earlier, and if this fell into that substance abuse RFP or not.
Oh,
So I'm gonna throw something out there, and you guys can like it or not. I think by the time we bring back the substance use RFP, we're already not meeting again until February. By the time we put it in, they have run out of grant funds. So I think that's a problem. And so I would throw out there some solutions. We could approve their project for a year or two, and or 3. I'm just gonna throw those because people are worried about the RFP. At least keep them funded until we do an RFP, if that's what people are concerned about. I would be happy to make a motion to however we want to do that, what feels comfortable for the committee. I don't think we want them to not have their program funded for the next year, and so I think our RFP is not going to be done in time, just in all fairness of how we work. And by the time this committee meets and everything, because we don't meet every month. So I would like to see how the temperature is about, can we at least, if people are uncomfortable, I don't know where our votes are at, could we at least do a year or 2, and then they could apply for the RFP, or can we just do 3 years?
I'm prepared to make a motion, but I want to make sure everybody who wants to comment has commented. Anybody else? Darcy?
So is there a way to do a grant? You know, say a grant amount up to $750 or $500,000, whatever they're comfortable with, and then, you know, a chief and his team will be out looking for other grant dollars, and they may not need it all. And we're just setting aside the money, and when they need it, they have the opportunity to come and ask for it, whether that's at fiscal year end close, or I don't know how Fort Bragg does that.
Darcy, isn't that tomato? I mean, it's gonna be reimbursable anyway. And so, if we.
But you're not making him do an RFP, so I don't know.
Right, no, I wanna make a motion that we do this for 2 years, with the chief providing us with quarterly, numbers. And honestly, you know, if it's not gonna work out, if it's not as fruitful as it already has been, then, you know, there would never be an additional year. But to look at the whole menu list of everything that you folks are doing answers a lot of questions that we've had before that nobody was doing. And for $500,000 for 2 years, to have two people working for 2 years of doing this in and out of the city of Fort Bragg, I really think we're getting our money's worth. I understand with what other people are saying about RFPs, but when other people came for us, Jackie specifically, it wasn't for a $250,000 RFP. It was for a multi-million-dollar obligation that there were some people who were not even eligible to receive the services, and I don't think Fort Bragg is picking and choosing who they decide to serve. They're serving the most needy population of our community. So my motion is to approve the chief's request, and I appreciate the informative letter you gave us for 2 years, and we get quarterly statistics.
I will second that under, just to fill in what the members said, if you're good with this, that they'll continue to look at other funding streams and up to $500,000, because I think that will make people feel comfortable. Are you good with that?
Yeah, 100%.
Any other, so it's been
You have Joe.
moved in session?
Seconded. Joe has her hand up.
Yeah, I was gonna
But
say, any
the
other
other thing
discussion?
would be to, if he does get his grants, that he notify us right away and not ask for anything more from us. And I don't think just handing the city of Fort Bragg $500,000 is wise. I mean, how do you pay this?
Reimbursement. He tells us how much it costs over the last quarter, I mean, to the penny, and they get reimbursed just like any other
Yeah.
bill that we get.
You would have to send in an invoice.
Sure.
Okay. But then I would also like to ask that if he gets the grants
Sure.
going forward, like he's been getting, that then we stop and he runs on his grants and we're just basically a stopgap.
Joe, I'm not gonna add that to my motion, but I trust the chief enough to where if he gets a grant, we would reevaluate everything. You know, I don't think he's gonna get a grant and not tell us. We're all,
Oh, yeah, I think he probably would do that, no.
no, he wouldn't. We're all in this together. We're all in this together, so.
No, I don't need to make light of it, but I
Okay.
just wanna make sure that it's all out on the table.
Point well taken.
I really have a problem with giving Fort Bragg a chunk of money, but I love what Neil's been doing since he got here.
And I would just clarify, it will be a contract, Joe, just like any time else. We will do a contract with the City of Fort Bragg Police Chief, and then it will dictate all of the terms and how to send invoicing, and it'll go through behavioral health, just like the other contracts we do.
Perfect.
For Measure B.
Okay, and then what are we gonna do when Ukiah comes to us?
Well, let's know what they have to say.
You've been waiting for me to ask that. Thanks, Tom.
You're welcome.
Okay, it's been moved and seconded. May we have a roll call?
Can I
Wait,
ask
Donna
for the
has a
motion to
question.
be read, please?
Sure.
Approve chief request for 2 years, providing quarterly numbers.
I'm sorry, I didn't hear a dollar amount in there.
500K.
Yeah, his request was for 750, so, yeah, approve his request for 500,000, requesting quarterly numbers, and for you, Joe, I'll put in there, if it's okay with a second, that if you receive additional funding, you'll advise us, and we can reevaluate.
And we were supposed to put in there that he'll continue to look for other funding, and they'll look at other funding streams that Darcy threw out, look at other funding streams for like transportation and stuff to help cover their costs.
And we'll give you 1 minute to get that all written down
Well,
before
I'd
you
like
read
to
it back to
I'd
us.
like to specify that it's 500,000, but it's 250,000 per year for 2 years.
Right.
Correct.
I think that's language should be in there.
So I agree with yours. Tom, do you agree with what I added?
Yes, I do.
Okay.
Darcy wants to say something.
No, I just, it's $250,000 for 2 years, per year, if
Yeah.
you need,
Yes.
Yeah,
right?
yeah,
I mean,
right.
that's the top level, and he's gonna maximize his other funding sources
Right.
and can talk
Right.
to us if he needs help in connection with partnership or whoever, right? We can help that, so hopefully the 500,000 will last 3 years plus, right?
There you go.
Right.
Okay, you know I'm gonna ask.
Approve chief request for 250,000 for 2 years, providing quarterly numbers, and he will continue to look for other funds and let the board know if they got any grants.
Just change it to $250,000 a year for 2 years.
Yes, per year.
Per year for 2 years, yes.
And maximize other funding streams, but I'll make sure we add that in
Okay.
and maximize
Alright.
other funding.
Great. All right.
All right, can we get a vote? Are you good?
I'm
Donna?
fine, I just
Okay,
wanna make sure
good.
the two motioners are good.
Okay, I'm good. Tom's good.
Okay. Member Pierce,
Yes.
Member Bradley,
Yes?
Member Moschetti,
Yes.
Member Allen.
Yes?
Member Anto,
Yes,
Dr. Miller,
Yes.
Chair Evans,
Yes.
Member Wilford.
Yes.
Oh, just say no to be.
Good work, chief. Thank you very much.
Thank you all very
Motion
much. I
passes.
truly appreciate it. Thank you.
Thank you for all the work you're doing.
Yeah, I think it's amazing.
Yeah, really.
Double their cost.
Sounds like great.
Same.
Okay, moving on, item 4, committee member reports. How do we do this?
Claudia, calls the name.
Oh, okay.
You have to do the roll call for everyone to report out, so just.
Okay. Member Pierce,
And nothing to report.
Member Bradley,
With behavioral health, we have rewritten our bylaws, as the Board of Supervisors had asked us to do. We are now 11 members. The last member is due to be sworn in at the beginning of December. We have done elections, and we're also going to be doing information panels to help educate not only the board, but to educate others. And anybody can come who is interested in these panels. We're going to be doing Brown Act. We're going to be talking about 5150s, 5250s, how they work, how the money is allocated that we get from the state. There seems to be some confusion about that the money that we pay for people that go into hospitals is being paid for by the county, and it's actually paid for by the state, but it's requested by the county. So we want to get all that clarified, and it all needs to be educated, everybody that is part of this. And that's why we talked about having people on Measure B coming as well. Somebody like Darcy probably understands where all the money comes and goes from, because that's part of her job, and Sarah. But some of the rest of us are not so much. And I have just been going through some stuff, and I learned things that I didn't know. The other thing I just want to say is Dr. Miller and how she runs our behavioral health is a jewel. And I think, I think we need to appreciate her and understand that the amount of work that woman does and how she takes care of our clients, nobody gets to hear about all that until they're in it. And I wanted to share that. Thank you.
Member Mosqueda?
No report.
Member Alman?
The mental health wing of the correctional facility is on track. I would encourage you to drive by Low Gap and see what's happening. And it will be opening November next year, so literally a month after the PUFFS unit, the mental health wing of the correctional facility will be open. So right now, I want you to picture this. In Mendocino County, these are words I never thought would be said. We have $65 million worth of buildings strictly for mental health victims. That's pretty incredible compared to where we were 10 years ago.
Member Anko?
I would like to thank Joe for her comments, and soon to be, I believe, City Council member of Willits, Tom Almond, for his comments about the jail as well. And then I would like you all to know on January 14th and 15th, we will be holding a board workshop. This is a workshop, it's 2 days, out at the River Valley Training Center. And we will have a safety panel, public safety panel, as well as a homelessness panel. This is education. No action will be taken at this meeting. It is an attempt to bring in 2 new board members to the Board of Supervisors through some education and collaboration. There is an opportunity at the beginning of each day to make public expression though. But no action will be taken. Anything that needs action will have to come back before the board. Also, I would like to let you know, Supervisor Jurdy of 4th District has retired from the board. So we will be limiting any type of controversial items before the board in December and moving those into January and February, where we have a full complement of the board. And then Denise Parker is in your room right now. Hopefully she'll stand up and move closer to Donna or somebody, I guess.
Oh, you don't want to be closer to
There you
me.
go. There you go. Denise is our new social services director. We're very happy to have her here. She's born and raised in Mendocino County, went to college here, and has come home to support and be with her family. That again is very native to this area. So, Denise, I don't know if you have a couple of words to say. And by the way, we do call her Dee Dee. So,
I know.
Go ahead.
Thank you. Hi, I'm Dee Dee. I'm on day 7.
Wow.
So it's been a lot of information, a lot of names, a lot of faces. I'm very excited to be back. I keep hearing about all the great work that's being done. I'm very excited to hear about the new facilities. And it's just been a very positive experience. And I've been gone for 22 years. I'm very much enjoying the rain. Coming from the desert for 22 years, I was in Vegas. But yes, I was born and raised here. My whole family's from here. So.
Good. Welcome.
Welcome.
We're glad you're here.
I have a quick question. Darcy, that training session that you're doing with the board, is that open to us to come to?
You can come and watch. It will be on YouTube, Joe. So we'll stream it like everything else we do because it's educational, and we hope to educate the board as well as the community on the various higher, volume topics that we have. The second day we will be having, Department of Transportation, Planning and Building, Environmental Health, County Council, and a fiscal report out. So the second day will be interesting as well, but you will be able to view that on YouTube. Thank you to Scott, who is in your room there.
Thank you, Scott.
Dr. Miller?
So I just want to remind everyone, Care Court goes live December 1st, and so we've been doing a lot of informational talks, different committees and meetings, and we have some probably workshops and different public announcements we're going to be getting out regarding Care Court. So we're prepared. We have been working with our courts and our public defender, and we are ready to go. We'll see how it rolls out in Mendocino. The small counties don't have a lot of referrals, so we're going to see how we align with the rest of the state regarding that. I also wanted to note one of the things that Joe said to me recently, which I think is important to know, was that one of the psych facilities, not in Mendocino County, ResPath, that operates Red Bluff in Redding, had let her know that the mental health system in Mendocino County is very unique, and that we'd go above and beyond for our clients, and that they were really impressed. I guess even one of the people there are hoping when we open our facility to move here and work in our facility. And so I think it's just a really nice compliment to get when we don't hear a lot about what's happening in mental health, but to have a facility that's not local, that deals with multiple counties across the state, to acknowledge our system of care is pretty amazing.
Member Aguirre?
I don't have a report, but I'm wondering when our next meeting is.
February.
It will be in
No,
February.
it's not February. Because.
Yeah, it's February.
How can that be?
It's 3
Every
months.
quarter.
December, January, February. It's quarterly.
Okay. I won't be here. I'm gone for 2 weeks in February. I thought it was March. Yeah.
Well, your vice chair will have to fill in. Joe, that's you.
Just in case you didn't know.
Just in case you didn't know. She looked shocked. Did you notice that? So, it's you, Joe.
No, 3 months though.
It's
Oh yeah,
November.
December, January, February.
All right, is that it?
No. Member Wilson?
I'm so sorry, Mary Alice.
Thanks, Donna. I don't have nothing to report out, but I did want to take the opportunity to thank Acting Auditor Sarah Pierce and her team for the fabulous work that they've
Yes.
done on the budget and getting that $7 million back to us to do
Thank
other
you.
services in the community with. So thank you guys. I know you've
Don't
worked really
need some
hard
more.
and long hours, so. That's it.
Wait a minute, it's February 26th, right?
Yeah, it'll be the fourth Wednesday. The fourth Wednesday. So you'll be here?
Okay.
There you
All
go.
right, is that it?
Okay, we're
All right.
adjourned. Thank you, everyone.
Thank you.
Thank you.
Thank you.